Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Team Needham podcast studio. And we are super excited to have Dr. Shannon Connolly on our midweek podcast this week. She is a chiropractor out of New Jersey, and she teaches women virtually how to treat probably acute pain too, but a chronic pain, since it is so common. And guess what? Because she's a chiropractor, she doesn't prescribe any drugs. So as two pharmacists that don't believe in drugs, she is preaching to the choir about this stuff. So Shannon, welcome to our show.
Hi. I'm glad to be here.
Yeah. So tell us, I introduced you shortly. Tell us a little bit about your history. And I didn't know that chiropractors could graduate when they're 19.
I think I was actually like 24. I'm still pretty young, but like
You look really young.
I'll keep it that way. I'll take that as a compliment,
right, yeah.
definitely.
My wife used to get comments like that. She'd get carded when she was in her 30s. And, you know, when you're in your mid-20s, you kind of get offended, you know, about that stuff. But I'm like, hey,
yeah.
Deal with it. You'll love it later.
Absolutely. No, I mean, it's funny, when I used to do more traditional chiropractic work, you know, I'd work with obviously people who were 10, 20, 30 years older than me. And definitely I would get the look of like, you're going to be my doctor today? Okay. But now looking, I'm in my mid 30s now, but now looking back, I'm just like, yeah, we all start somewhere, right?
Right.
Yeah.
So tell us a little bit about your history.
Definitely. Yes. So I'm trying to think about just like the whole journey, the whole like process I think I've been on in the last few years. So really, I feel like this all started during COVID. Actually, back in 2018, 19, I was working in New York City, doing more of the traditional chiropractic practice, you know, seeing 20, 30 people in a day, just like back to back to back to back. And, you know, COVID obviously shut that down real quick. And I remember honestly sitting at home and I was just like, what am I going to do? Like, I can't see people in person. I can't, you know, put my hands on people, manipulate people anymore. And so I was like, all right, I have to figure something else out. And luckily in chiropractic school, we do get a little bit of rehab education. And I believe at the time too, a lot of, you know, things were being done virtually where you could like learn and, you know, kind of develop new skills. And so, I just started kind of going down that rabbit hole, and slowly but surely just realized that I could still do a lot of good, even if I wasn't like in person with somebody. You could still do a lot of movement. You can help people just like move their bodies more. And I even remember at the end of the day too, like most people who are dealing with some sort of like chronic issue, like weren't really exercising all that frequently. So, you know, in my head, I'm like, isn't exercise like kind of the best medicine we do have? And so, fast forward to today, like working more with like women who definitely are struggling with chronic pain. You know, maybe they've done all the traditional, like chiropractic, physical therapy, massage, acupuncture, a lot of like the passive modalities to try to like mitigate the pain, but still are like struggling with it in one way or another. And realizing that, you know, they might have to take more of a proactive approach to like really overcoming that, like, you know, getting a handle on their lifestyle, thinking about like implementing strength training. And so I try to do this in a way where it's just trying to provide more of a happy medium with exercise and training in a way that is like safe and effective for somebody with chronic pain. So that's kind of what I do in a nutshell now.
Awesome. So Janet, what questions do you have for Dr. Shannon?
Well, so I deal with a lot of women that are going through peri or menopause. And I feel like that's when the pain starts creeping in for a lot of women. Particularly, I think it really becomes an issue after menopause too, you know, and the lack of hormones and things. But you touched on something really important about lack of movement. And we do a lot today that is very repetitive. So can we address some of that? Because I feel like even in my own life, there's repetitiveness that causes some of these injuries as well.
Yeah, no, I mean, if you think about it, at the end of the day, exercise is stress. And so, yeah, when you have that dose of that over and over and over and over, maybe at some point your body's going to be like, okay, it just can't handle that anymore. And so, yeah, I think maybe the recommendation that's usually been given in the past, and I think this is, again, I'll just kind of hit on a myth or maybe misconception that I hear a lot, but like, the remedy to that is just to like rest and just like, right, take it easy, don't do anything, right, like give yourself some time to recover and then come back to it. But I think understanding too that maybe when you do recognize a certain position or movement, if done repetitively enough, like gives you that kind of element of grief, like maybe that's actually a good sign of like what you actually need to like become better at doing or become stronger at doing so that you can tolerate that more, you know what I mean? So yeah, I guess that's kind of like the mindset that I have when I'm trying to figure out, like from a training perspective or programming perspective, like how to dose this in a way that's like gradual, so that they just like get better at handling that over time. You know what I mean?
Yeah,
I don't know.
I do, because both Shawn and I have had injuries, or maybe just you're sore for something, but if you stopped moving, it got worse. It hurt
Correct.
worse.
Yeah.
Yeah,
So,
absolutely, for sure.
Well,
And I think, hey, like, oh, sorry, I didn't want to.
well, on that note, I think that's part of the problem when you look at most injuries. I mean, the places I get sore, my shoulders and my upper back, of course, the chiropractor,
Yeah.
you know this, and it's from actually doing nothing, being slanted over a car driving, or in an airplane, or in over a laptop streaming our podcast.
True. Right.
And it's so it really needs movement, it needs exercise.
Absolutely. Yeah. No, it's just like getting yourself out of those positions. I think it's kind of like that's the remedy. It's like being in one position for an extended period of time is taxing on anybody probably.
Right.
But I think like more movement and even just like dosing that through the day, I think could be an equally powerful thing as like even just like an hour training session, right? Like why not every hour, like get up and do something, put yourself in different positions for like a few minutes, just to give yourself like that dose, you know what I mean?
Right.
Yeah.
So what's your most common injury that you see in women when you talk about, or not injury, but treatment of chronic pain? What's your most common?
Yeah. Oh, that's a good question. I want to say probably a lot of like lower back, hip, pelvic floor kind of stuff. We'll say kind of more in that like midsection. I mean, definitely work with people with like neck issues and shoulder stuff and foot stuff, but I feel like it always comes central. You know what I mean? So I think that's usually the most common thing I see. And again, I do think a common, I guess, like misconception about some of the stuff too is that it's always a sign of like damage. Like anytime that your back starts to feel a little achy or maybe even like sharp, or more, I guess we'll use these kind of adjectives of like sharp or stabbing or just kind of like twingy, tight. I think people kind of equate that to like, oh, there must be something wrong. There must be something going on here from like a structural perspective that is like creating this like problem. But I feel like it's not so simple as that, right? It's not always just like a singular thing at the end of the day.
Yeah. I mean, when you talk about your midsection, your hips, I just kind of just came to me. It's probably no wonder that that's the most common injury. And I'm going to guess for men too, possibly, in that area, because that area probably gets more stress than any other area in your body, right?
Yeah.
Yeah. I mean, when you think about any athletic movement, whether it be, swinging a baseball bat, or whether it be, biking, whether it be water skiing, it all comes from that area, the hips. That's where all your power comes from. So it's
Correct.
no surprise that, or that's where all your power should come from. It's no surprise that's a common chronic pain.
Right. Absolutely. I mean, it's like your center of mass, your center of gravity. I mean, it literally connects upper trunk to lower trunk. Right. So it makes sense that like kind of the common thing would go to, that area.
Well, even small things that people don't realize too that can be important that I learned, that I wasn't wearing the right pair of shoes. Like I was not at work wearing the shoes that gave me support, but it wasn't exactly like I felt like a lot of pain. I just felt nauseated and didn't feel very good. But once I put the right shoes on, that didn't happen. And I can tell you in a heartbeat when I'm wearing something that's not good. I mean, it's like strange how putting your spine and all that in the wrong place can make a big difference.
Yeah, no, you make a good point about that. Like there's a big connection with just like our feet. Like, I mean, think about it. Our hands and feet are very sensory, right? Like that's literally how you like feel the ground underneath of you and and your body responds to that, right? So yes, like definitely footwear and, you know, just the environment of that can create, sometimes some problems. But I guess I don't know if I feel like I might have posted on this somewhere on my Instagram, but I feel like I have maybe a perspective on feet in the sense of like, you want to make sure that your foot, your ankle, you know, like your plantar fascia, like all of those small joints and muscles that we have are really strong. And I think sometimes we become I think footwear now has become, like this, I don't want to say Band-Aid, but like almost they're like too supportive sometimes. And I think like we kind of take away from our natural ability to like do the work ourselves versus like a shoe like formed in a certain way to kind of like do the work for us. And if you probably see from my Instagram, right, I work out barefoot. I don't wear shoes actually when I train, or I wear like these really minimalist kind of shoes because I feel like I can stabilize myself actually a lot better with that. Just different perspective.
Yeah, and I know there's a lot to be said about
a lot of stuff. Yeah,
well, and there's a lot to be said about grounding, and so going barefoot. And I used to, when I was growing up, I was barefoot everywhere. So for one thing, my feet were tough enough to walk on rocks and gravel, and I remember the other day, Jan and I were changing after a bike ride, and I'm in my bare feet on rocks, and it's just like, oh, this hurts. But I need to get better about that. And there's actually, you probably know this, there's actually some long distance runners that run barefoot. And one of the things they say is, you know, some of the shoe companies have not done runners any justice by making these shoes that are so supportive. In fact, it's caused bad running form because the runners don't know how to run properly because they just let the shoes do the work for them. And, you know, so, you know, there is probably something to be said about that. When you look at us as Jen, I talk a lot when we talk about diets, we talk about movement, we talk about sleep. We think about what our ancestors did, you know, generations and generations ago. Well, they weren't wearing high heels, and they weren't wearing, you know, running shoes with this thick a sole to cushion. They had bare feet or very flat sandals. So
that is so true. That is so true. It's interesting to think about all the technology, right, that's like available today. And, you know, I don't want to like completely bash, I don't know, like footwear and stuff like that. Cause I know for a lot of people, it could be very helpful for like a period of time. But I think we can't discount the fact that, like, again, maybe just building up that tolerance, building up that strength, building up like your just ability to like, even like spread your toes. Like think about most shoes now are like pushing your toes together. And like, I think that's why people are getting bunions and like plantar fasciitis and things like that. It's just, your toe, it's almost like walking around with mittens. Like you remember the old mittens back in the day before they had like the finger mittens, like, I don't know, like your fingers were, you didn't do anything with that. So I almost think it's kind of the same thing with a lot of footwear that's just kind of like pushing your toes together and all that stuff. Yeah.
That's a really good point. So tell us about a success story that you've had. Tell us about that.
Oh my gosh. So many.
Yeah, right.
So many. Oh gosh. I'm just trying to think of like one off the top of my head. All right. So I'll tell one. I'm sure she'll be totally fine with me telling the story. So this woman, I should say Hannah is her name. So she's a mom, has a couple kids. I know she's had quite the extensive history with like pelvic floor actually issues, and had done, I mean, rounds of like physical therapies, been to multiple doctors. Like it was like a 4 or 5 year probably journey for her before we even started working together. And I'll be honest, I remember even chatting with her through Instagram. That's how we connected. And something I probably posted of, on my content probably like resonated with her. But I remember her being like so skeptical. Like she just did not understand how, like, I don't understand how you're not even in the same room with me. And like, yeah, we're doing this whole thing virtually. And I remember she was just really skeptical of like how this whole like virtual thing could work. But slowly but surely, we finally she agreed to like, work with me. But I think the one thing from just understanding her history and all the things that she had tried and done and like had worked through was like, there was no like jump to like training. You know what I mean? Like everything she did was really just putting her, I think, in this box of like protecting and like, don't do this and limit this and like all just the list of like do nots, which I think just like puts people just more in a box of like really narrowing their abilities and like their, I guess like physical drive to like do something more active and kind of pushes them outside of their comfort zone. And I think that's what a lot of women with chronic pain probably need is a little bit more of that dose of like uncomfortableness, right? Because if nothing changes, right? And I know that can be really hard, right? Because like it feels uncomfortable and like we don't like pain. It's a very unpleasant feeling. But I think recognizing the fact too that like when you have more physical ability and you have more resilience and you can like even do things when it is slightly intolerable, like that's only gonna probably build more of the pattern of like you becoming stronger and being able to like tolerate it more. So yeah, I think slowly but surely, I mean, I don't want to say this even happened overnight. Like I've been working with her probably for the last like 1.5 to 2 years at this point. And I want to say like, we've had moments that, are really good and she was feeling amazing and like things are like rocking and rolling and she's moving and she's hiking and she's like doing all this stuff, but she's equally had moments where she's had other things pop up with like knee stuff and hip stuff and foot stuff. And I think being able to work with somebody and help them navigate in those moments, I feel like is really valuable because I think they just learn, okay, how to get better at handling it kind of thing versus like, oh, I avoid and I rest and then I try to like get back to training. I think people kind of flip flop between that, either side of the spectrum versus like always trying to find the happy medium of what you can still do, even if it's uncomfortable.
Well, I think you start telling people too that they can't do something like you're saying, it's kind of negative, not just physically, but mentally.
Yes.
It kind of tells you it's like, well, gosh, man, I'm getting old. I just can't do this stuff anymore. So you really have to kind of make people do it, or help or guide them along the process and work into it.
Yeah.
Well, I also think too that we assume that pain is always bad. And I'm not saying that it should be sharp and excruciating, but sometimes to get through something, you have to experience a little uncomfortableness to get that joint or knee or ankle or leg working, because if it's stationary, it's just been my experience that when I'm stationary after I've been injured, that it actually hurts more. Like the pain is worse. So learning that it's okay to tolerate. I mean, there's a point where it could be too much, but at a certain point you have to realize that it's going to be uncomfortable for a while, but the less that you use it, the more uncomfortable it becomes.
Correct. Yep. It's like the risk outweighs the reward, I guess, in that sense, right? It's like, and I think that's something I, have learned along the way to even set that expectation from the go with people is like, we need to actually expect things to be a little bit uncomfortable. And maybe that's actually like a good thing because we are like showing it and kind of like reteaching ourselves that we can tolerate discomfort. Because I think we've all been told and taught that like, yeah, we shouldn't feel pain. That's like, again, that means something's wrong and that we like shouldn't feel that feeling. But maybe actually like leaning into that and like learning to be more comfortable with it, like is actually like a superpower and not something to be like afraid of.
Right. I mean, there's a term in endurance sports, get comfortable being uncomfortable. And you have to learn what what that comfort and uncomfort is.
Yeah, right.
It's true. When you think about, historically speaking, generations and generations ago, our body, we're meant to be stressed. Our body is meant to be stressed physically and
Absolutely.
mentally. And if we don't put those proper stressors in, our body won't respond like it's supposed to respond.
1000%. Like stress can be a good thing. Yeah, it doesn't have to be a bad thing. I think that's why it always comes back to dosage, right? It's, I'll use medication as the example here. I know, we're not like necessarily about that, but it's like dosage, right? Like if you do end up taking a medication and it is maybe too much or not enough, like what do? They adjust the dosage. So like, I do think maybe this is where exercise could be kind of used in the same sense of like, how do we dose this in the right way for somebody that it's the safe amount of stress. It's like a healthy amount of stress somebody can tolerate.
Well, a perfect example of that is, Jan and I talk all the time about, the best antidepressant ever devised is exercise. Period. There is there is nothing better than exercise for depression. But speaking of dosage, and timing, if you do intense exercise right before you go to bed, probably not a good thing. You're not going to sleep well. You're not going to go to sleep, probably. You'll eventually sleep well.
Right.
That's why dose is important. And if you exercise too much and don't recover enough, then you're going to have issues. So I believe in dosing of exercise totally. It's a good analogy. Thank you for bringing that up.
Yeah, no, you're so welcome. And I know that can be really hard to figure out too, like, especially if you are dealing with pain, or like, I know I work with a lot of women too, where, maybe they didn't really grow up being like an athlete, like movement and exercise for them, maybe personally it's not really a part of their identity yet, kind of thing. But I think they are recognizing that you can use it just for like health, right? Like just feeling better mentally, physically, right? It doesn't have to come with PRs and, training for specific events and stuff like that. It's not only reserved for that. It can just be good for like your general health.
When you speak on that, we had a podcast on this subject a few weeks ago with Sean Casey, and it was basically, and he is a personal trainer for some Olympic athletes at the Olympic level. But we talked about how, everybody should treat their body like an athlete. Because really, when you look at how our bodies were designed, we were designed to move most of the day. So we and every once in a while move really fast, and every once in a while lift things really heavy.
Yeah.
We were really, we were created as athletes, so we should all treat our bodies like that. Even if we don't consider ourselves an athlete, we really should treat our bodies like that.
Yeah, no, I agree. Definitely. I think there's something special about like exerting yourself in a way, that again is like a hard and takes effort and like maybe is for a specific goal or kind of task in mind. So yeah, no, I definitely resonate with that, but I can understand for a lot of people out there, if like that's never been their thing, they just never really fit that mold, like that can be really, challenging and like uncomfortable to try to like do something that's just never been their thing before. So yeah.
Well, I think too, the sad thing, and most people that have been involved in some form of sport understands that it's not just the, like Shawn touched on it, it's all the endorphins and the transmitters that are released in your body that make it better. And we do have our own mechanism to handling pain, and movement helps that. So if we aren't moving, it's not stimulating our body to do those things for us, because a lot of people say, well, you have a high, like to one person, or you have a high pain tolerance. It might not really be that. It's that their body learned to tolerate and how to handle it and release that. And then when you get into like, anxiety and depression, or even stress, like a lot of people in our culture are very stressed. Well, exercise helps you deal with that stress because it forces you to do something other than what that stress mechanism is. And a lot of times, to explain to people, especially endurance, I kind of lean on this a little bit for my own self. I find a space in my brain that helps me get through things that's comfortable, right? Like it's in my own space, my own time, but yet that exercise is the place that it happens. So, it could be music, it could be other things, but I think people don't realize that it doesn't have to be huge movements. It doesn't have to be in, like hours and hours, but it is a healthy place. And if you haven't done enough exercises to get there, it's really kind of a sad thing, I think, because I think as people become more movement orientated, they can find that for themselves.
Yeah, no, I do. I say sometimes to the people I work with, that the best way to get out of your head is into your body.
Right.
That's usually what I say,
right?
It's a
Like,
very good way
point.
of explaining.
Get out of your head. And I will say, I also learned that from somebody else. I didn't coin that myself, but shout out to, actually, I worked with a behavior coach for a while named Shelly Belk. If you want to look her up on Instagram, she's awesome. She was like really good, like mindset reminders, but like thinking about get out of your head, into your body kind of thing.
That's a really good point. So
yeah.
What was the other one you said before we were on air? Motion is lotion?
Oh, motion is lotion. Yes.
I
picked up all these little like phrases just from like mentors that I've learned from years. And yeah, one of my other mentors that I've learned a lot about, just like kind of bridging that gap between like rehab and training for people, right? Because I think, again, in this world and society, it's like rehab's kind of in one area and then like training's on the other side, but like to blend the two and to kind of find more of that, like, again, happy medium, safe place, sweet spot for somebody can be like, it takes maybe a different like perspective or just kind of like framework, I guess, to use rather than kind of like a step-by-step protocol. But yeah, one of my mentors, he always used to say like motion is lotion, right? Like
it's a great one.
It lubricates things, it keeps things flowing, blood flow, all this stuff. So yeah.
Yeah. So as we wrap this podcast up, Dr. Shannon, tell us what you have a passion for.
Ooh, I have a passion for bringing like a more flexible approach to exercise, we'll call it. So I think at the end of the day, like strength training is like the best form of healthcare that we have available. But I think the way it's been kind of like presented, I think in culture and society, like some people really resonate with and kind of like are kind of fit into that box. But I think we maybe unknowingly have left a lot of people out in that process. And I think that's what I'm trying to do is kind of bring like a different perspective, a different approach, a different like mentality behind like thoughts and beliefs, right? When it comes to exercise and like, how somebody kind of has that relationship. Because I think, again, in our world, right? Like, I mean, right. I grew up in the 90s. I mean, I remember seeing like the skinny models on TV and like, like all of that stuff. And I think exercise for the longest time too has been promoted purely as a way to like change the way you look, right? Aesthetics wise, like for whatever, I guess, like beauty standards like there are. And so I definitely am just trying to like build more of the community and just kind of thought process that like it doesn't have to be this like big, crazy, like stressful thing. Like it can be very much the way you build more confidence in yourself, the way you just like make yourself mentally like better mental well-being. I think it can be so powerful for I'm trying to think of like the word here, but like I guess I use the word resilience, right? Like my coaching company, I call it like be resilient, right? And it's literally, I think resilience, I guess I chose that term too, just because it's even in the face of failure, even in the face of messing things up, you try again, right? Right. It's almost like getting good at like the messiness of it. And so that's what I hope people can experience with like exercise. It's supposed to be messy. It's supposed to be like engaging and like a good thing for us. And it doesn't have to be this like big stressful struggle, like negative type thing that I think it's kind of like maybe people have had that perception about it for a long time. So
Right,
I know
right.
that's a long-winded answer, but
No, I love it. I love it. That's great. That's great.
No, I think what I'd like to hear about this is because the journey of life, in order to have an optimal life, we do need to move throughout periods of time. And it really makes and resonates with me because we have a coach that is one of our clients, and she's in her 80s, and she's teaching women like 60 or 80 women a week. And her whole perspective is like, move at the level you're at. But the more you move, the more active and more enjoyable life becomes. And it doesn't have to be like you're that bodybuilder, or that even in the space of my husband, an endurance athlete. You just, the movement keeps you living in this world in a better way, and you find more joy. And I feel that that's kind of what you're saying is, it's in a different space for everybody, but that movement keeps us going to live a better life.
1,000%. Yes. Yeah. And like your goals can be different than somebody else's goals. And like where somebody else is starting at doesn't have to be the same thing that you, right. It's all about figuring out like what's best for you, right, as an individual. So yeah, no, something I love to help people figure out for themselves, like what matters most to them, like what do they want as a goal. It doesn't have to be somebody else's goal.
Exactly.
And I think, a lot of the people I think I work with too, like they say, like, I don't need to be a bodybuilder. I don't need to PR. I don't need to like have all these like big athletic, I guess, kind of aspirations, but yeah, they just want to feel like stronger, more energized, being like more productive through their days, being able to like get on the ground and play with their kids and their grandkids and all that stuff. So yeah, that's what I build pretty much like programs around. Like, let's do that. let's figure out how to do that.
I love it. So I found you on Instagram. Here's your Instagram. Tell us a little bit about it, and the best way people can contact you.
Thank you. So yeah, Instagram is a fun thing. It's pretty funny. I'm really glad that you found me through Instagram, but fun fact, I know it's like September. So I have like, a follower account. Again, I'm not trying to like make this a vanity metric, but like I have over 23,000 followers now. Honestly, just 3 months ago, I had like 7,000. So
wow,
like,
good for you.
If anybody's out there that like, because I know Instagram is a great way to like, it's like your portfolio, right? Like it's a great way for people to get to understand you, like your perspective on things, how you work with people, like what your, kind of what your personal maybe like struggles and things are like that are about. And so it's just funny how like, again, I never thought I'd be using Instagram in the way that I'm using it now. But no, I think it's fabulous that you guys like actually found me and clearly resonated with my profile enough to like reach out to me for me to be on this podcast today. But yes, my Instagram is at Live Well with Dr. Shannon. I really try to be mindful about just the types of content that I post and kind of the things that I talk about. Like you'll see, for example, on my page, right, I have no before and afters. I have no like I don't know, like images of just like aesthetic stuff. Like I'm really trying to just build more of the awareness around like, this is just for like your optimal health, and you don't have to have any like big, I don't know, like PR lifting goals. Like this is just more about like how do we still get the benefits of strength and flexibility and mobility and elasticity and speed and power, and like do that in a way that is like meant for you and where you're at and your goals and like what matters most to you, kind of thing. So yeah, I hope my page does kind of that.
It worked for us to find you, and I do follow you, and pay attention to your exercises and stuff, and I really love what you're doing. Jan and I, being two pharmacists that don't believe in drugs to treat most chronic diseases, including pain, it resonates with us. It really does resonate with us. So
awesome. Well, no, thank you so much. I really appreciate that.
So Dr. Shannon, thank you for being on the show today. And you've helped us realize our goal, which is to educate and empower individuals to take charge of their own health. So we really appreciate you being on.
Awesome. Thank you so much.
You're welcome. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Monday to our regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Thank you.